Hi, welcome to the Verto webinar on COVID-19 testing center capacity optimization with online appointment booking and pre-screening our solution. Just want to make sure, Michael, Jill, can you guys hear me okay?
Yep, can.
Okay, super. So I'm very excited to have Jill Strong, the Director of Operations at the Thames Valley Health Team, and Dr. Michael Anderson, who works at a variety of different large health systems in Toronto. They're going to be really speaking to both the macro challenges in terms of COVID testing, and then Jill's really going to give us some detailed feedback on what it's like to run a couple of the assessment centers. I think they're currently doing about 900 tests a day, and what her experience was in trying to do it manually, and then what her subsequent experience was in using our solution. Jill and Michael, I'll just get you to do a couple quick seconds for self-intros. Jill, would you like to go first?
Sure. Yeah, thanks, Jim. As Jim mentioned, I'm Jill Strong, Director of Operations for Thames Valley Family Health Team. It's one of the largest family health teams in Ontario. And I have the pleasure also of co-leading assessment center work in my region, which is the London Middlesex region of Ontario.
Thank you, Jill. Michael?
So I work in a lot of different spaces. I guess I'm best summed up as a recovering surgical oncologist who practices palliative care medicine. But I also work in research at the School of Public Health at the University of Toronto, and I work in the Regional Cancer Program in Toronto.
That's great. Thanks, Michael. And my name is Jim Burnett, and I'm the VP of Sales and Marketing at Verto. So for those of you who aren't familiar with Verto, Verto has a solution that has a variety of different capabilities. Today, we're here to talk about our appointment booking, pre-screening, workflow management for testing and assessment center solution. That solution is currently used in a variety of Canadian and US testing and assessment centers. We also do COVID test tracking. So I don't know if any of you saw the press release that came out with Air Canada and MHL Labs, where we were actually tracking the test kits that they were giving international passengers when they arrived at the terminal, and we were tracking those test kits through their pickup, the logistics process to deliver to the labs, the lab testing process, and then we're actually communicating those results directly back to the patients. And at our heart, we are an interoperability solution. So our platform came from being able to connect EMR, HIS, LIS, hospital, acute care EMRs, long-term care, home care, community care all together. And the reason I share this with you is certainly if you're just looking to solve your appointment booking, pre-screening COVID-19 testing center problem, we can do that. When you're done with us, turn us off for 30 days notice, everything's good. But you may also want to look at some of our other additional capabilities. So you could look at this as an investment as opposed to something that's simply an investment and then we'll have a life cycle that will be short and then you'll terminate that agreement and be done. So here's what we're here to talk about today. Our testing center solution capabilities. Now, the first thing I'll call out is you can a la carte us. We're going to show you a lot of different capabilities, just like that insurance commercial. You can only pick and pay for what you need. It can start with pre-screening and pre-registration information that the patient can do online. They can book that appointment, get appointment reminders, confirmation, cancel or reschedule. You can also do the logistics handling once the patient shows up on site in terms of what parking entrance should they come in, what door if it's a physical assessment center. Tell them to wait in their car until you're ready for them, all those patient logistic communications. And then we can also give you visualization of the actual patient flow through the testing process. How many people are waiting in their cars? How many people are in the examination rooms? How many examination rooms are waiting to be cleaned? How many people have exited the process? And then that really gives you visibility into any friction points in that process. So you really do have an opportunity to optimize testing center capacity and throughput. I'm going to let Dr. Anderson speak really briefly to some of the macro testing challenges for COVID-19. And I'll just turn it over to you, Dr. Anderson.
So I'm going to probably really focus on three things, and one of them, this background diagram is kind of the good backdrop for the first one, which is we often develop and implement innovative solutions in healthcare, and then we frequently drop the important piece, which was to actually have some real-time feedback. So it's good to develop something it's even better to have an effective evaluation and feedback loop so that you're doing continuous quality improvement. Probably more importantly, it's important to do it in a real-time fashion. So this is a Sankey diagram. It's a bit of an industrial tool that shows you flow through a pathway. But we use this, or we see this in a real-time fashion, where you can actually see what's happening in real time and then modify your program as you go. So in something like a COVID assessment center, having an idea where your pinch points, your bottlenecks, what's working well, what needs improvement in real time is beneficial. The next thing I'd speak to, and this is as a person who works in a health equity space, is I'm really attuned to COVID assessment centers. COVID is not an equal opportunity disease. It affects different populations and often fairly marginalized populations differently. So when you improve access, you have to think that you need to have access that's equitable. So having a widget, a website, has an upside and then a part you have to be attentive to, that a certain segment of the population will use a front-facing widget within a website. In fact, a lot of people will, and that's really great because it frees up administrative capacity. But you really have multi-channel access, because there's going to be a segment of the community, and it might be 20%, that really need a more personalized touch. They need an ability to call in through a phone line, to access in a way that fits with their abilities and their comfort level. So I like the fact that you really have multiple channels of access that enable you to maintain a health equity lens. And the last one that I think is important is having some empathy for the admin people. We often forget in healthcare that the first people that patients, families, consumers have contact with are often admin staff and clerical staff. So they bear the brunt frequently of people's stress, their anxieties. There's no question around COVID testing, people have anxieties. So we have a frontline staff that are bearing a lot of this anxiety, and we need to have some empathy for them when we build systems. So designing systems that have some recognition of what frontline administrative staff face. And I get to fall on a sword as a surgeon years ago in our cancer program. We built a diagnostic assessment program that we thought was fantastic. And we talked to the clinicians and the surgeons, and it changed absolutely nothing until my admin explained to me that the way the world really worked was that all of the pain that we perceived was actually borne by the administrative staff. So if you don't build these things, if we build them with the clinician in mind, we miss that, frankly, we're often the least important part of this process. So I think it's important when we build these programs to be attentive to all of the people who are providing care, and to be particularly attentive to the very first face that consumers, patients, families see, which is often admin staff. So there's certainly an element of this that is trying to lighten the load and the burden on the first people that people contact with the administration. So
that's great. Thank you very much.
Turn it over.
Thank you very much, Dr. Anderson. For those of you who have questions, we're going to be saving those to the end. Please use the chat function, and we'll be saving them up, and we'll get through as many of them as we can. If we don't get to you, then by all means email info@verto.health, and we're happy to follow up after today's presentation to answer additional questions. And Jill, with that, I'll turn it over to you as the person who kind of lived the before and after picture between trying to do this manually and then putting in an automation solution to help.
Yeah, thanks, Jim. So to Jim's point, and as you mentioned earlier, in our region, we have two fairly large, we have many folks doing testing in the region, but two large facilities that combined see about 900 patients per day. Sort of the background for us is we operated it for about 6 months as a walk-in service and did that really with relative success. But in September, we sort of saw the perfect storm, which was the return to school, the really prescribed criteria for testing for students, that school age group, as well as some community outbreak around that time that led to really, really significant stressors on the assessment center, so high volumes. which naturally led to really long lines in a walk-in service. It was not ideal. When I say lines, I'm talking about vehicles on the road in the communities in which we operate. So that was not well received by any. And actually, to Dr. Anderson's point, the frontline providers who were seeing those patients waiting in line first thing in the morning till end of day to be seen, they did bear the brunt of it, and also turning away some patients because the volumes were just too high for us to handle capacity daily. So none of that was easy for us. Combine that with the ministry mandating that we had to move to an appointment book model meant that we had to very quickly make a transition. So for us, actually, we had easy access to a phone line system that we could use for these purposes. So we rapidly transitioned to that. And I speak very transparently when I say within a day, we realized that was not a sustainable model for us. So might work for assessment centers that are maybe smaller in regions where they can support the volume, but the volumes we were doing daily was not possible, even with enormous commitments, resource commitments to support it, that we could regularly and ongoing support the booking of approximately 900 appointments a day via telephone, and it was not live answer, it was voicemail callback. So that meant chasing patients to get them on the phone. It was really challenging for everyone, patients and our providers alike. So I actually happened to be on a working group call one day, and I heard that the hospital in our region had been in touch with Verto for other reasons. But I think probably the key piece of information I heard that day was that Verto could do implementation at a rapid rate. And I thought, okay, well, I'll give a call and see if this is true and possible. And it was 100% true and possible. If you want to switch slides, actually, sorry, Jim, I missed you on the slide switch, but Jim and I and the team connected one time briefly prior to us deciding to implement, and we moved forward on a Tuesday, agreed to implementation, and by Thursday night we were going live. So that is the level of rapid implementation I'm talking about. It truly was about a 2-day period. And, commitment on our end was fairly low in terms of the workload to getting this up and running. So naturally, we had to describe what we needed and the screening criteria and the number of appointments per time slot and all of those pieces. But once that information was transmitted to the Verto team, it was very much managed on their end. So that was a very clean and actually easy process, and it was very much appreciated as we were still at the time managing the telephone booking mechanism. That was not going so well. So once we had it implemented, the outcome for us was really the relief on the administrative team. It allowed us to put a few administrative folks back out on the floor at the assessment center doing registration, which was hugely helpful with the volumes we were seeing. We really struggled on the phone to keep up with booking 400, actually it's about 900 a day. So this was a wonderful solution for us. We had easy uptake on the system from both the patients and our employees. The team had an easy time adapting to it. There wasn't a huge learning curve to using it. Although Verto offered training in spades, we didn't really need it, which was wonderful. And we found it very customizable. We were able to really make it our own. And, as COVID has evolved over the past few months, we've had to make modifications and changes, and that has been very easy to do. Most of it controlled on the user's end rather than having to do back and forth with Verto if we didn't want to. However, the team is very supportive of us when we reach out and say, hey, can you give us a hand with this? There just isn't bandwidth here at the assessment centers to do it. It's been very adaptable, and as I mentioned, hasn't required a ton of man hours on our end. So it was really hit the ground running with that, and it's been a wonderful solution for us. I think probably one of the key features is important to note is that it allows patients who have booked through the platform to cancel their own appointments. So we actually see that daily in real time where a patient will cancel. We'll see it on a list because we print them in the morning, and someone else will fill that slot. So it's really reduced our number of no-shows or unused appointment slots, which is key for us when we're trying to see as many people as we can in the run of a day. And it's great because it works really well as we augmented as well, to Dr. Anderson's point, with telephone booking as well as a small amount of walk-in, which really is designed to meet patients where they are. So if telephone and online platforms aren't available to our patients, there is available option of walk-in service, because to your point, Dr. Anderson, you're right, not everyone can book this way for COVID testing. So overall, we've just found this solution to be exceptional, and it's met our needs, I'd say, in every way. So.
Thank you, Jill. We really appreciate that very detailed day-in-the-life experience and what it was like to try and automate your testing and assessment center manually, and then what your experience was with our solution. I really appreciate that feedback. So let's talk about the actual solution overview itself. So all of the functionality I'm going to show you next is a la carte. So you can turn on as much or as little of this functionality as you want. And so the first option that you have is you can do pre-screening as part of your booking process. And what some of the testing and assessment centers realize that they would benefit from doing that is the testing slots are incredibly valuable and very scarce. And so there may be some people that they want to prioritize in terms of that booking. Healthcare workers, long-term care workers, home care providers, etc. And there may be some people who are non-symptomatic that they just want to say, hey, wait, or go to a pharmacy to get a self-test, because they really want to reserve those high-value appointments at the testing centers for people that really have a priority need. You don't have to do that. That's an option. If you do want to go down that path, then you can have some pre-screening questions, and those pre-screening questions can actually have some logic to them. So my first set of pre-screening questions might always be the same, but then when I find out this is an elderly person, I might route them into a slightly different set of questions. If it's someone who's accompanying a child, they might get a slightly different set of questions. Or in the example that I used before, if it's a long-term care worker or clinical staff, then they may get different questions because they're actually going to get access to a different prioritized set of appointment booking slots. Message totally configurable that you would then send back after they've gone through the pre-screening. If it's a non-symptomatic person, you may just say, hey, congratulations, you don't need to come into the testing center. You're trying to reserve those slots for the really high need people. And if they do have symptoms, you can say, hey, okay, thanks for giving us this information. Here's your appointment booking slot. Again, that's an optional step. If you just want to take them right to the booking widget that I'm going to show you next, no problem. So we're going to embed a booking widget right on your website. And so that's really important for two reasons. From a patient experience and from a branding perspective, is they're not going to click on a button and take them to a completely different site. And they're not going to have to download a mobile app. So as far as they're concerned, they're dealing with your healthcare organization. So this booking widget will reside on your website, and all of the activities that would result from them starting to book an appointment would happen on your website. And so the first set of questions, the pre-registration questions that some of the assessment and testing centers find helpful to ask is it just going to be you coming? Or are you accompanying a child? Or are you caregiver to an elderly person? And that's helpful for three reasons. One is, if it's just one person, then that may only be a 15 appointment block. If it's two people, that might be a half-hour appointment block. If it's two people, I may also want to send out 2 pre-screening questionnaires or 2 pre-registration questionnaires. And if it's 2 people coming in, then just simply from a logistics perspective, if this is an in-facility testing workflow, then it's good for me to know there's going to be 2 people in the waiting area, 2 people in the examination room. And so from a safe patient flow and logistics perspective, good for me to know it's 2 people instead of 1 person. All that pre-registration information completely configurable by you and your team. Once I do go through that process, then I get to the dates that have time blocks available. Again, you can publish on a daily, every 3 days, weekly, monthly basis. What are those appointment blocks that you have available? And you can split those into different buckets. You can say, well, there's a certain portion that's available to long-term care workers or healthcare workers. There's a certain portion available to the public, and there's a certain portion that we might reserve for in-house staff. That might be for in-house staff to facilitate booking for someone who's not tech savvy. So you're going to facilitate an elderly person doing a phone booking, or it might be for in-house staff testing that we want to hold those appointments aside. Again, totally up to you how many buckets of those appointments you want to have and what criteria determine who gets access to which buckets of appointments. Once I pick my date, I have my time blocks for which times are available on that day. I click on the time I want, and then I get a message back saying, hey, congratulations, you've successfully booked your appointment. Now, again, I have an optional step. We're now going to start to send them reminders. Now, the reminder certainly has value in saying, hey, Bob, don't forget next Thursday at 2 o'clock, you have an appointment booked. But more importantly, we found that many of the testing assessment centers, despite the fact of how scarce and hard to get these appointments were, there was actually a very large percentage of no-shows, like 10, 15%. And that's because people would book an appointment at one testing and assessment center, then find an earlier appointment at another testing and assessment center, and then they wouldn't go back and cancel the other appointment. So the reminder has language in it, and we can put a big red button that says, hey, by the way, don't forget your appointment next Thursday, but would you like to reschedule or cancel, to make it really easy for people if they do want to make those changes and keep that no-show rate very low. And you can set up the frequency for however often you want to do that. 3 days in advance, day of, 4 hours in advance, totally configurable by you. Then what we want to do is we want to provide a visualization so that in-house testing assessment center staff can see exactly where those patients are, that patient population is in those different workflow steps. So if it's an in-facility test, you might have, well, here's how many people are waiting in their car who have arrived. And then you can actually have texting back and forth or email back and forth with that patient. Hey, stay in your car. We don't want you coming into a crowded waiting area where social distancing is a bit of a challenge. Just wait in your car, and then we'll text you when we're ready for you, and there's an examination room available. That way they can go right through the alcove, right through the waiting area, right into the examination room. Or you can have them come in and wait in the examination room, and then you have a swim lane, and this is a Kanban dashboard, and you'll see this as an example of 4 swim lanes, where it's here's how many people are waiting in their car, or here's how many people are waiting in the waiting area. Here's how many people are in examination rooms. Here's how many examination rooms are waiting to be cleaned. Here's how many people have exited the process. Now, how many swim lanes there are, how you want to break that down, what you want to call each of those different buckets of the patient population, each of those swim lanes, totally configurable by you. If it's a drive-through, it might simply be, here's how many people have texted us that they've entered the parking area. Here's how many people are waiting. Here's how many people are in examination areas. Here's how many people have exited the examination area. And that just gives you really good visibility into how are the patients moving through those testing workflow steps. And then the other thing is you can actually configure some intelligence into that workflow. So if, for example, examination room has been empty for more than 10 minutes and cleaning staff still hasn't cleaned it, then to optimize threshold capacity and throughput, then we might kick off a reminder saying, hey, somebody should get in and clean this room so we can bring another patient in. You do have additional capabilities in terms of patient engagement and patient education. So instead of just sending them a reminder, you can also send them educational information. That can be as simple as don't forget to bring your health card, don't forget to bring a mask. But it can also be very specific and personalized to that particular patient based on the pre-screening or pre-registration answers that they gave you. So an elderly person might get different protocol or patient engagement information than someone accompanying a child. And so you really have the opportunity now to maximize the preparedness of those patients as they come in for their appointments and answer any questions of FAQs that frequently come up that you can be proactive in providing them with that information. We provide extensive analytics, so you can actually start to run the metrics and say, well, what is the average portion of no-shows that we have? How long does someone wait before we're ready for them to come into the examination room? What is the average time it takes us to do the testing? How long does a room that's been exited stay empty until we clean it and bring in another patient? And how many patients do we see on a daily basis? Those are the kind of metrics that once you have visibility into them, you can identify friction points to really maximize throughput and capacity. And if you really want to get automated, then you can incorporate things like QR codes, where when you send them the reminder, you can embed a QR code in that reminder. When they show up for their appointment, they just hold their phone up and you scan it. You could put a QR code on the door to an examination room. And when you go to check that person into that examination room, you just scan the QR code on the door, and then it automatically moves that patient from swim lane 1 to swim lane 2 or from swim lane 2 to swim lane 3. So you really have some pretty robust automation functionality and capabilities if you really want to make this a touchless process. And then you can do post-satisfaction surveys. So certainly that's useful from a patient satisfaction perspective, but equally importantly is you can also potentially identify things from patient experience challenges or friction points that may contribute to your overall capacity and throughput. So in addition to your own internal analytics that you're measuring and running, you may get patient feedback that gives you insight into things that you hadn't thought of that helps you to optimize capacity and throughput, and in addition to improving the patient experience. And you can implement all of this functionality, as I said, in an a la carte manner in groups of functionality that make sense based on what your priorities and current challenges are. So if your phone system is being overwhelmed, if patients are on hold for 30 minutes or more, if it's hard for patients with non-COVID related problems to get through, if your admin staff is getting overrun and burned out, then you may just want to implement something that solves those problems really quickly, like an online appointment booking widget, a simple pre-screening or pre-registration form, some pretty standard workflow, swim lane, Kanban dashboard visualizations. And that's something we can stand up in like 3 or 4 days. And then you can start to see some value. And then if you want to do something more configured, so you want to have, well, you do want to have prioritized pre-screening. So there's going to be one workflow for the pre-screening for elderly people, a different pre-screening workflow for people bringing in children. Then you have the opportunity to do that and maybe have more configurable pre-registration information as well. That takes a few more days, but then we're only up to 5 to 7 days, and you can solve those problems. And then if you really want to go, full automation where you have EMR integration and you're going to use the QR code technology, then that takes about 3 to 4 weeks. And you can do this in a step manner. So you don't have to pick 1, 2, or 3. You can start with one. And then once you've started to see the value of that and everybody's kind of comfortable with that capability, then you can move to level 2 or level 3 and implement it in a phased process. And that is pretty much our presentation today. We're going to start going through your questions that you initiated in chat. If we don't get to you, then you can certainly email info@vertohealth.com and look for the next webinar that we have coming up on January 19th about vaccinations. The same platform, the same capabilities that we'll be talking about can be used for vaccination delivery and tracking as well. Okay. What percentage of patients use the combination of phone? Jill, I'll get you to speak to that. What portion now is online versus coming in via the phone?
Yeah, so we're about 90% online, with the other 10% being some combination of telephone and walk-in access.
Okay, there's another question about looking at the Kanban, the swim lane dashboard. How do patients move between phases? There are 3 different options. One is you can just drag and drop as one person moves from one step to another step. And Min can simply just drag someone from swim lane 1 to swim lane 2. You can use automation. So when the patient texts you that says, hey, I'm here, that can automatically move them from appointment to registered and confirmed. Or you can use the QR code, that as I scan the QR code on their phone, it'll move them from swim lane 1 to swim lane 2, scan the QR code on the room, move them from swim lane 2 to swim lane 3. And you can do hybrid. You can say certain aspects of the workflow we want to be automated, other aspects of the workflow we want a check step or someone to manually move the patient between those steps. Which EMR integrations are possible? As an interoperability platform, we have some pretty significant advantages here, and that we're pretty used to doing integrations with Cerner and Epic and Meditech and most of the major EMRs. We also have some patented machine learning integration capabilities that allow us to do those really quick. So a normal Cerner Epic integration might take 4 to 5 months. We can do that same integration in 4 to 5 weeks. With respect to patient education, does it talk about the appointment testing or preventing COVID? So the content for patient education is completely configurable by you and your team. So we have some canned patient education information about COVID protocols and things like that you can certainly leverage. But the patient education information really is completely configurable by you. And again, I just want to emphasize, it's personalized. So an elderly person may get completely different patient education information than someone accompanying a child. And that's really important for really being able to maximize the effectiveness of that kind of messaging. Is there any prioritization mechanism in place for people who want to book an appointment on the same day? That's really up to you, right? So that workflow, that pre-screening information is really what dictates who has access to which appointments. And so whatever criteria you set, if you want to provide prioritization to people who want to book on the same day, then that would be part of your workflow. Did I miss anybody? Anything Michael Anderson or Jill you would like to add? You're on mute, Michael.
Most of it. Yeah, no, I think you, hopefully I'm off mute now. I think you covered most of it. Yeah, I think you touched on most of the relevant points. I do like the equitable access that this offers to people.
Okay, that's great. Thank you everybody very much for your time. Special thanks to Dr. Anderson and Jill Strong for your participation in today's webinar. That's greatly appreciated. Again, if we didn't get to your questions or you have some subsequent questions, email us at info@verto.health. By all means, revisit the website. We'll be sending out an e-blast shortly in terms of the vaccination webinar if you're interested in that. Thank you again for your time. Have an excellent day.